Hi, my name is Lyric. I'm a recovering fentanyl and heroin addict, and I am 19 months sober. I just wanted to let you guys know that in the state of Texas, between the years in 2021 and 2022, there was an 86% increase in fentanyl-related overdoses. This is for the state of Texas. Wake up, people. Our friends are dying.
Hello, everyone. This is Emmanuel Cook. We will be reacting to a new video today, so make sure you guys like, comment, and subscribe down below, and let's get into the video.
So I'm gonna have like a complete transparent moment. I have came to the terms that I might lose my daughter before she even turns 21. October 6th, 2022, our lives changed forever. My daughter overdosed on fentanyl. She was given a pill that she didn't know was fentanyl. That was fentanyl. And she overdosed. I had to revive my baby. And I'm forever stuck with that image of watching my baby turn blue. Try to get her help, but because she has not been addicted for a year, I can't get her treatment. So I'm looking at my daughter every day, and I don't recognize that little girl. I don't recognize my baby at all. She's lost so much weight. Her skin is gray. She is in the clutches of addiction, and she's trying to do it on her own, and she can't, and trying to find her a therapist so I can get her to talk about her traumas, because my baby's been through so much. But I just had to go through all my photos of my baby. Thank God my mom who takes a lot of pictures, and I found all the pictures from the time she was little up until recently. And I'm just going to make a photo album and mentally prepare myself to know that my baby might not make it to 21. It's so hard. And I feel like such a failure. Like if I was in a better mental state, would my daughter be going through this? This is the shit that nobody talks about when you're a parent to a child who overdosed and survived. My baby is still walking dead. I'm watching my baby die in front of me.
So 1 out of 5 addicts in recovery go on to live a successful life in recovery, which means that 4 out of 5 people relapse and fall right back into the same routine. According to SAMHSA.gov, there are around 48 million Americans that struggle with substance or alcohol use disorder. There are roughly 3,000 physicians that are specially trained to treat that. What that equates to is for every 16,000 addicts, there is 1 physician. That number is absurd. So, I just encourage you to spread awareness, do what you can, talk about it, because we've got to do something, because, our kids are getting hooked on this shit coming from overseas, and it's killing our country.
So, I just left the emergency room. I have chronic pain issues, so I'm in the emergency room a lot, unfortunately. And if anybody who deals with chronic pain issues specifically, and has to be like in the hospital a lot, you definitely know what I'm about to talk about, with the opioid crisis and how you get treated as pain seeking, when you go to the hospital. Because, if I go to the hospital and obviously I'm in pain management, so I take Percocet daily. I take Percocet, and that don't even do shit, so that's a whole nother conversation. But so obviously my pain tolerance is really high. So if I go to the ER, I don't want no fucking Toradol. I don't want Tylenol. I literally, it's not going to do anything. It's not going to touch the pain. And so I have a crazy high tolerance for pain meds because I've been in pain management for quite some time. And I don't even know where I'm going with this, but I want to have a goal this year to change things with this opioid crisis, because so many people are hurting, so many people are suffering, so many people can't get help because they're treated as pain seeking. And like I get it, right? Like I get it. Like I know there's a crisis and I know there are things that have to change, but in the same token, they're punishing people who actually need help. I literally, like, there are so many times where I have to gamble if I'm going to go to the hospital and hope that it's going to be worth my time. I have to hope and pray that I get a doctor who is not going to treat me like a pain-seeking client, and hope that they help me. And every time I go to the hospital, I'm all smiles, because I know that if I'm extra dramatic, that's just going to be a ding on me. I know that if I go in there feeling how I feel, I go in there sobbing and crying, and every now and then it happens because shit, I'm pain. But I have to go in there with a smile on my face. I have to go in there extra happy and act a certain way to hope that they will help. That has to change. And I don't know where to start. Like, I don't know what I need to do to start to create change, but it has to happen because it has to change.
Man, that first story literally broke my heart. And it is so painful as a parent when you have a child that is battling addiction and you want to save them and you want to get them the help that they need. And you're doing everything in your power to help them. And it's not working. And you're slowly losing them each and every day. That is the most painful thing. And honestly, it sucks that we don't have enough resources for things like this. That people go through a lot and they just do not get the help that they really need to recover and to improve their lives. I cried in this story, honestly. Wake up, people. Our friends are dying. Our children are dying because of drug overdoses. Is a very serious thing, especially in the United States. So many deaths are caused by opioids.
Today I wanted to talk about the medications that are available in the US for after surgery. So as we know, there's a huge opioid epidemic, right? And this whole thing with if you're in chronic pain, you can't get prescriptions. It's like a complete nightmare. I'm not entirely sure how it is in other countries, but in the US, it's horrible. When you're in chronic pain, you have to basically beg and beg and beg to be given anything to even remotely help the pain. And then you're given a medication that you get 5 pills, and they're like, we'll see how this does. It's like, okay, this is ridiculous. Anyways, whole point of this story is in Europe, at least in Germany, I'm not sure about every country, they have this, which is Targine, and it's 20 milligrams of oxycodone, and it also has naloxone, which is Narcan. And what is Narcan? Oh, it prevents overdoses. Why is this not available in the US? I talked to my doctor here, and he was absolutely amazed that this even exists, because he was like, why does this not exist in the US? Someone please help me understand. This would probably solve the problem.
10 days ago, I lost my son to addiction, to an overdose, something he only recently confided in me about. My baby was 26 years old, and he wanted to get better. He fell into a trap in a system where mental health care is lacking at best. And so he turned to self-medication in the form of opioids and became addicted, and he wanted help. And in the process of me trying to help him find that help and having door after door slammed in our faces and being turned away from programs or given another number to call or transferred to a different department, he lost his battle, and he was poisoned by the serial killers that we call drug dealers. And my boy, my beautiful, beautiful, beautiful boy, I don't know how to pick up the pieces. I don't know how to, and I wanted to help him, and he wanted to get better. I love my son. I'm not ashamed of my son. My son was strong. He was strong enough to ask for help, and the system failed us. The system failed him. What's it going to take? What's it going to take for things to change? For our young people to stop being poisoned for there to be health care and mental health care in place to help them when they're crying out, they're begging for help, when a mother asks and begs for help. But her child's an adult, so oh no, they have to ask themselves what they're asking, and nobody's answering. And I lost my son.
I am an emergency room doctor in the United States of America, and I'm making this video because the opioid epidemic continues to plague our society. Every day I work, I watch people suffer. I watch their families suffer. Nearly 100,000 people died from opioids just last year, and that is just immeasurable. The suffering that addiction produces is immeasurable. The families suffer. This isn't a plague of just the individuals that use drugs. Their families suffer. Their communities are being destroyed. So there has to be a sensible public policy to address this, and I haven't seen any yet. All we can do right now is offer people treatment and make it available for them. That's it. This is obviously ineffective. The families who suffer with these addicts cannot force them into treatment. And that is reasonable, actually, because if you force people into rehab, as soon as they're done with the rehab, they will start using drugs again because their mind is not right, they're not ready. But there more can be done. There are medications out there that can be forced, that should be forced on these people in order to get them to, in order to help them. And not only help them, but help their families, help the communities that they live in. Drug addicts, people who are suffering from addiction, are unable to make their own decisions. They are unable to understand their condition. The drugs cloud their mind. We can clearly see that they are unable to make their own medical decisions reasonably. So what I would do if I was a politician, if I was in power, I would create a public policy that would actually help these people. I would utilize the resources at my disposal to help them, to force them into help. Nobody cares about these people like their families do. As soon as an addict enters the criminal justice system, as soon as their life is clearly falling apart because of their addiction, their family should get medical power of decision over them immediately. They should be easily able to apply it and easily get it because obviously the addicts themselves are unable to make their medical decisions. And with this power of medical decision making, they should be able to force them into detox facilities where they will be rapidly detoxed and then injected with Vivitrol, which blocks the effect of opioids. So you can't get high anymore. And once these people are stable enough, they should maybe get their own power back over their own medical decision making. But every time they relapse, if they survive that relapse, their family should immediately revert to having a medical decision making power over them. And it's that simple. It is really that simple. This empowers the families to actually help these individuals because once they are detoxed and placed on Vivitrol, they can no longer get high. It would be exceedingly difficult to get high. And resources should be made available where this is actually enforced through the legal system and these people get these shots. If we were forcing people to get COVID shots, especially young people that didn't necessarily need them, then we can certainly force the people who are falling apart, who are destroying themselves, their families, and their communities to receive shots that will stabilize them and actually help them, help everybody involved. That's what I would do if I was a politician. And that's what I think needs to be done. It really needs to be done. And if somebody has the ear of the politicians, there should be a pilot program doing this. And I am almost certain that it would be effective. It wouldn't be perfect, but it would certainly be effective. That's it.
A quick reminder, please remember to like, comment, and subscribe down below, and let's continue the video.
So the only advice that I can give for this is to not enable them. They have to want it for themselves. They have to be ready to put in the work to be clean and sober. So that would mean like not helping them with a place to live, not giving them money. And yeah, they may get angry and they may say some hurtful things, but in the long run, they'll be thanking you. I know for me, my family didn't enable me, and that led me to my rock bottom. And after I got help, I was so grateful that they didn't enable me, because I don't think I would have ever gotten to the place of like despair that I got to, you know.
I haven't been on here for a while. My stepson recently passed away, and he was 20, and Just had a baby not too long ago. And I want to say this to bring awareness. And fentanyl is a very, very dangerous drug. And we have a lot of people dying from fentanyl, and them thinking that or Percocet or something else in a pill form, but they're cutting these pills with fentanyl. And he took what he thought was a Percocet, and he passed away very quickly. And my heart was broken, and my heart breaks for anybody who's going through this. And all of my kids, he was so young. He just turned 20 this year, and now his son has to grow up without him here. His mother is devastated. All his siblings, his girlfriend, his father. We need to do a lot of healing as people, just in general. I don't care what type of person you are, but communication is a big thing, and understanding, because parents, I don't care whether you have small children or grown children, you need to be involved in your children's lives and understand that mistakes are a part of this life. And we've got to, don't push them away when they make mistakes. Pull them back in, because they need to know that there's hope, and they don't have to run to these type of things, because culture pushes it so much, especially listening to certain music, like, listen to what they're listening to, what they're talking about, like what they're watching. Like, there's a certain lifestyle that just promotes the use of drugs, right? And it's the life is fragile, and you need to love on your children, love on the people that are around you. Reach out to people who are your strong friends, your friends that are struggling, like the person that's isolating in your life. Like, they need to know that someone cares about them, and sometimes there are things that are beyond our control, just like this situation. But we've got to do something about this, For a person to think they're just going to take something and go to sleep and, not intentionally harm themselves, but just like, I'm going to reset. I'm going to go to sleep and wake up and try this over again. And then there's not a wake up and a try again. I have been experiencing loss since 2020 of a lot of people that I genuinely love and care about. And it has been super hard. And I understand I just want it to go away thoughts. Like, I just need to reset. Like, I get all of that. But there's too much danger out here. There's too many people who are trying to make money and don't care about your life, especially with these pills that people are popping these days, that you do not know what's in that pill unless you made it, unless you have a prescription for that pill. You don't know what's in the pill. So please, please, do not buy pills off the street. Do not buy pills from other people. Because unless, like I said, you created that pill or you have a prescription for a pill, you don't know if it's safe or not. Because my brother yesterday fell and injured his arm really badly, cut it open to where he had to, they had to put a tourniquet on it, and he had to have emergency surgery yesterday, and they gave him fentanyl at the hospital, But in a controlled environment, fentanyl is more powerful than heroin and morphine. And unless it's administered by a doctor, you are running the risk of losing your life. My stepson took this pill, and within 2 or 3 hours, he was not here. By the time that they got to him, he was already not here. This was a young man that haven't even had a chance to fully live his life. Parents be nosy. I would rather my child be mad at me than not here. You have the right to know what's going on with them. Yes, I understand once they get older, but you got to start early. You have to start putting these things in them early. You have to communicate with them and talk to them. You have to walk this life through them, not this messed up perception of what perfection is, but this life of pain, this life of mistakes, because we all make them. Please, please, please let your children know that you love them and that they have somebody to talk to without judgment. Somebody that they know that they can go to with their problems and not try to escape. Please educate your children, please.
If you're a parent, check up on your children. Remind them that they can come to you for anything without being judged for it. Remind them that whatever they experience in this life, that you are a safe place for them. This is very important. A lot of times, parents have no clue that their children are on drugs. Their kids feel so ashamed of how low they are in their life. And the last thing that they need is the talk, is constant ridicule and judgment. They don't need that. They need love. They need massive amounts of support as well. No judgment, no criticism. Parents, you have a serious job to do. Make sure that you create a space for your kids to tell you anything. Let them know that mom and dad love them very much and that they will be there for them through thick and thin. Through anything that they experience in this life, that their parents have their back.
Hi friends, I'm making this video just to bring more awareness to our drug epidemic that we're experiencing and that we've been experiencing for a super long time. Before I started as an ED nurse, I had no idea how bad it was. I knew it was bad, but I didn't realize just how bad it was. Every single day I have at least one patient that is a drug overdose, and just think about how many nurses we have at our ED that has like 100 beds. So that's a whole bunch of patients. At least I get like 1 or 2 a day. That's so, and like think about that for every single nurse. That's so much. The only time I have had someone pass away in the ED since I've been working, it was a full arrest because of a drug overdose. So I just kind of want to explain why people kind of overdose from drugs and like what makes them not be able to breathe and maintain their airway. So when you are doing drugs and you overdose, it makes your respiratory system really depressed, and it just makes you extremely sleepy. You're so sleepy, you're not breathing. You're supposed to be breathing 12 to 20 breaths a minute. These people will be breathing less than 12. I've had patients who have had a Narcan just because we've given them too much pain meds. So I had a patient who was breathing like 7 to 8 times a minute, and I told the doctor, I'm like, okay, we need to Narcan them. But this is what happens on the streets as well. These people, they don't have anyone who are watching them breathe 7 to 8 times a minute or less. And then they just breathe so slowly that they eventually stop breathing. The oxygen's not perfusing their brain, and then that's why they go into a full arrest. Majority of the people who are found down on the street, it's just a bystander calling in. Never use drugs alone. If you're doing drugs, do them with a friend. That's the number one advice I can give you. Use clean needles. You can do a needle exchange. There are so many places that do needle exchanges. Also, Narcan, this is 4 milligrams Narcan. It's a nasal spray. I can get Narcan for free from my work. If anyone who's watching this lives near me, let me know. I will get you some. It's really good to have on you. We give out these Project Dawn kits to anyone who comes in as an overdose. It has needles, testing strips, and Narcan. We give this out because you're not just going to stop using drugs because we tell you to. You're going to keep using, but at least you're using safely. So we give these out a lot. Also, one more important thing that I actually learned today. So Narcan can send you into a withdrawal because you're giving them that reversal of the opioid, and it can immediately send you into withdrawal. And then, like they'll say either they come into the hospital or they don't come in the hospital, whatever. Someone Narcans you and you don't come in. And then an hour later, you're like, oh, I want to use again. Well, you can overdose again because that opioid is still circulating in your bloodstream. And then you get high again, and you're like giving yourself like double the amount that you would normally give you, so you can overdose again. So I just think that was important to be aware of that. You can overdose again easily after doing Narcan. Narcan works for all opioids, so heroin, coke that's laced with fentanyl, any pills, most Cleveland drugs now.
The opioid crisis in America has truly negatively affected people with cancer pain because it like that whole stigma about opioids has truly like been so tough for like these patients to get pain meds, and a lot of the time they fall through the crack. So recently I just got referred a patient for palliative care with severe colorectal cancer that has metastasized to the lung and liver, and they were prescribed oxycodone 5 milligrams every 4 to 6 hours by their pain specialist, but this pain specialist didn't specialize in cancer pain. So since they were told they could take it every 4 to 6 hours, they started taking it every 4 hours. And when they asked for a refill, they like wouldn't give them the refill because they said, oh, you're taking it too often and you're not due for a refill yet. And that was like really frustrating for them because they're like, well, you said it could be between 4 to 6. So we got this patient, I saw them, and I changed the oxycodone to 10 milligrams every 4 hours as needed. And then I added methadone, 2.5 milligrams BID. And so far the patient has been tolerating it great. When I called the local pharmacy to put these orders in, they actually gave me a hard time about it. And this was like maybe the second or third time that this has happened, but not as bad as this time. So I always call the pharmacy to tell them I'm putting in a narcotic prescription because I know they get kind of worried about it. But this pharmacist sounded like they were kind of lying on the phone that they didn't have the methadone in stock. And they were like, yeah, we're like, don't carry it right now. And then I was like, well, can you order it? And they were very hesitant to answer that question. And when I went on to say, please, like I have someone with severe colorectal pain and this pharmacy is like the closest one to them, then they were like, okay, we actually do have it in stock. And I was like, okay, great. So I went in and put those orders in, and then they were like, I guess scared to fill it and told me, hey, like we can't prescribe 2 narcotics at once. And I tried to say one is like a long acting, like that's methadone, and one is like short acting for breakthrough pain. They're completely different. And they're like, yeah, but like we typically don't. If you send us your notes, we will do it though. And I was like, send you my notes. So I had to like fax them my notes and everything. And I said, is this policy? And they said, yeah, it's our policy, which is interesting. I haven't heard of that before. And then they said, moving forward, I had to send my notes every month for them to do refills on my patient. I understand that people are scared, but there's a difference between a long-acting pain med and like a breakthrough pain med, especially for severe colorectal cancer that has spread to the lungs and the liver. Like people don't really understand how painful that is. Like this person can't even sit down on the chair. But yeah, I don't know, just circling back, that it's just really sad, the stigma of opioids in America. And I know people take advantage of them. So people who truly need them like can't get access to them. And it just sucks.
I understand why doctors are so scared to prescribe things like this, because it can be very addictive, number one. Number two, it can poison you and you can easily overdose. But if you have a high pain tolerance and you are in chronic pain, then using these drugs would help to soothe the pain. But still, you guys have to be very careful. It's very addictive. These drugs can harm you more than it can actually help you.
Hey everybody. So I just had my pain appointment, and this is something that I've been wanting to talk about for a long time. And it just kind of reminded me and got me all worked up again. So I'd like to talk about pain meds, pain management, doctors. I don't know what I'm allowed to say, what I can't say. I don't want anything to get censored on TikTok, so I guess I'll just call it the O crisis, is specifically more what I'm talking about. But the issues that started, I'm a nurse. I have not worked in 3.5 years because I am chronically ill. Never in my life, I'm so disappointed, disgusted, and I'm so mad. I'm so frustrated in healthcare. I am frustrated at my own profession. I'm beyond frustrated, actually. I'm so angry that things are the way they are. I had no idea. And then I became a patient, and I'm shaking. When the O crisis happened, It was mainly because doctors were selling their scripts and making money, profiting off of this, right? And that was the main thing. Patients weren't doing anything. Sorry, I'm having a brain fart. I can't even like process. This is why I just am like, I'm the type of person that I would be out there doing something about this, getting it to change, but without the energy, without being physically able to, it's driving me freaking insane. So I want to start like a freaking revolution. Like this needs to change. I need doctors to get on board with this. I need patients. I need people. I need everybody. The O crisis was fear mongering. It's what it was. And it put the fear in doctors. They're either afraid to lose their licenses. There's so many restrictions, crazy restrictions on pain meds. It blows my mind. I was hospitalized in November because my pain clinic didn't get my script in time during Thanksgiving. It was Thanksgiving. I was sick going into this week, just with my illness. I was having an episode. Then I started to withdraw. I tried to fight it at home. Could not. I was hospitalized for 7 days, and it was one of the worst hospitalizations I've ever had. Doctors in hospitals treat you like a drug addict anytime you go in. Whether you're drug seeking or not. I haven't asked for pain meds once when I go to hospitals, but I'm drug seeking. I'm also an addict. These are notes in my charts. Never discussions with me. Never anything that I have said. So I've had doctors, specialists, GI doctors, other doctors tell me they will not treat me. They will not take me on as a patient if I am on pain meds. As a nurse, we are taught to advocate for our patients when they are in pain, to doctors, to the hospital. I didn't realize in the real world, people couldn't get scripts. People can't get scripts. It is so tightly monitored and regulated that for people like me who have no energy, the amount of hoops I am forced to jump through, it is so exhausting. It's making me sicker, actually. I also have an autoimmune disease, so my body physically attacks itself when I exert myself. But this is crazy. I've heard of other doctors losing their licenses for trying to help their patients, which again, I'm asked these other doctors, I'm like, if my friends were losing their licenses over something that I knew was right, okay, it is a medication. It needs to be monitored. There's a lot of education that needs to come from the healthcare professionals to the patients. Yes, I'm not saying that you just willy-nilly take these things, but it's not unlike any other medication either. There are many medications that you need that are contraindicated by other medications, by food. They have side effects. All dependency is a side effect. It's not addiction. It's not addiction. Say it one time louder for the people in the back. Dependence is not addiction. It is not addiction. It's not the same thing. It is a side effect. There's so many facets to this. There's insurance, which is a huge issue and a monster in itself, right? Then there's the DEA, and that's what we need to go after. That is what needs to change. My current pain clinic has mental health appointments that I think they make everyone do. I jumped on that. I mean, I've had mental health issues my whole life, so I've been in therapy my whole life, and I love that, absolutely. They're teaching people more about these meds and mental health, which is huge, because another huge misconception is substance abuse causes mental health problems. Like, all of them. Like, you're fine, you start using, say in high school, and you have mental health problems. Everyone's convinced it's a substance abuse. It's not. It's not. People have mental health. Mine started when I was like 7 or 8 years old. Mental health does not always, yes, substance abuse can cause mental health problems. Absolutely. Absolutely. It is not the reason why everyone has mental health problems. Okay? There's just so many misconceptions, but the biggest thing is when the O crisis happened, I wish I looked more into this like all these years ago, and for all these years, but it's so outdated. People who are on pain meds, who do not have their pain managed and cannot get any more because they're restricted to a certain number, a lot of them, probably turn to drug dealers, to the streets, to get something that, you know, stronger or more of. And that's when it gets scary, because that's where the things are laced with other things and you don't know exactly what you're getting, okay? The other problem is alcohol. Alcohol is worse than pain meds in every way, shape, and form. But so many people resort to drinking because we're literally left to our own devices and we have no other options. So I haven't drank in over 2 years. I physically can't because of my illness. I'm kind of pissed off about it, to be perfectly honest with you. I would love to drink. I would, because it's miserable. Living my life every day in, day out, being bedridden is miserable. And you're telling me that people in my situation don't deserve to have pain meds that cover at least a 24-hour period? It is absurd. It is absurd. So I don't know what to do. Like, I'm going to start with a petition because I physically can't do anything else. But please share this. Please, other healthcare professionals out there, other patients, like families of loved ones that are like, please come to me. Please help me. Like, let's get something rolling. I'm so dead serious. This can't continue. It can't. Something needs to change. So I don't exactly know what I'm going to do yet. I just know I'm going to do something. There's so many issues in healthcare right now, but this is one of the biggest, and it's one of the most problematic in so many different ways. But I mean, we can even just talk about withdrawal, which is again another side effect of the meds that you're looked at cross-eyed if you ever go through it and then have to be hospitalized for it. It is mind-blowing to me. So leave your thoughts. I'd love to hear them. Again, this is a discussion, 100%. So I would love to hear your thoughts and feelings. I welcome them. I will never tell you that your thoughts or your feelings are wrong. I don't believe in right or wrong. Everybody is different. Everybody feels differently about different things. And I welcome that and I love that. I think the reason why people are so incredible and beautiful to me is because of all the differences. And I personally love people's stories. I love to hear about how they grew up, their life, what they've been through. To me, that is like, I don't know, I just love to know what people have been through to make them as strong as they are and resilient. And that's the beautiful nature of humans to me. So thank you for letting me vent and just let me know what you guys are thinking. Bye.
You know, it's something that addicts have to deal with, like, even if they've been clean, even if they've had a year clean, 2 years clean, 3 years clean, whatever, it doesn't matter. This is just my perspective. If you have been in active addiction before, then you are constantly going to be underneath the microscope, period, from some people. Not everybody, but some people. It'll be, why do you still vape? Why do you have to lean on something? Why did you choose to use your money this way? Why did you choose to do this when you don't have to do that? Why did you choose to make this decision when you could have chose to make this decision? Even though anybody else can make any God-given decision that they please, and there is no vote about it. Nobody else looks at it. Nobody else judges it. Nobody else blinks a freaking eye at it. But if you were an addict once upon a time, then you will forever be criticized thereon after. That's stupid. Oh, and then there's why were you acting like this? I just noticed, like, you seemed a little tired. You just acted like you had a lot of energy that day. You can't just, like, be a normal human anymore and have days where you're low and days where you're high. You always have to be, I don't know, did you see how they were acting? You know what I mean? It has to be that. Let people be people. Like normal people. In recovery or not, people still have high days and low days, and people where they have high energy and low energy, and they shouldn't have to answer to other humans for that because it's not your place. Crazy, huh?
I understand this very well, but there are healthy ways to cope with things. There are healthier options to cope. A great healthy option is hitting the gym, exercising your body whenever you're stressed, whenever you're anxious, all these things. Yeah. I appreciate you guys watching the video today. Please make sure to like, comment, and subscribe down below, and I'll see you guys in the next video.